Today we are going to discuss about some nclex practice questions with explained answers. So let's start with the question. So the first question is, the nurse performs an Allen's test before blood is drawn from the radial artery for an arterial blood gas assessment, that is ABG assessment. This intervention is done to determine the collateral circulatory adequacy of which arterial vessel. In this particular question, the nurse takes the blood sample from the radial artery for the purpose of blood gas assessment. Before it, the nurse should perform Allen test. So, Allen test is done to determine the collateral circulatory adequacy of which arterial vessel. So, before going to the options, we will discuss about Allen test and arterial blood gas assessment. So firstly, let's talk about the arterial blood gas analysis, that is ABG analysis. It is a blood test in which blood sample is taken from the artery. Most preferable artery is radial artery, and after that femoral artery and brachial artery. And this test is mainly done to check the acid-base balance, that is acidosis and alkalosis condition in the patient. Mainly the blood sample is taken from radial artery. It is a most common site for taking the sample of blood gas analysis. If there is any problem in the radial artery, then we will go to femoral artery and the brachial artery. After that, there are 4 parameters of ABG analysis. In it, first is blood pH, second one is partial oxygen, and third one is partial carbon dioxide, and fourth one is bicarbonate ion, that is HCO3 ion. So first is blood pH. The normal blood pH is 7.35 to 7.45. If blood pH decreases than 7.35, then it indicates the acidosis condition. If blood pH increases more than 7.45, then it indicates the condition of alkalosis. After that, there is a normal partial pressure of oxygen, that is 80 to 100 mm of Hg. And third one is partial pressure of carbon dioxide. The normal value is 35 to 45 mm of Hg. And the bicarbonate ion normal values is 22 to 27 milliequivalent per liter. If there is any problem in the partial pressure of carbon dioxide, then it indicates the respiratory condition, or if there is any problem in the bicarbonate ion, it indicates the metabolic condition. After that, we will discuss about Allen test. The Allen test is used to assess the collateral or alternate blood flow to the hands, and this test is mainly performed to check the patency of the ulnar artery. Before taking the blood sample, the test performed is Allen test. ABG sampling is done from the radial artery. Here deep inside is radial artery, and here this is ulnar artery, and by anastomosis it's supplied to the fingers. By this way circulation occurs. So when we puncture this radial artery for the ABG analysis, before puncture we can check the patency of this ulnar artery, that blood supply by the ulnar artery is proper or not. If ulnar artery is not working, or if we cannulate this radial artery, so here there is no proper blood supply in the hand and cyanosis will be seen in the hand. So to prevent this, we should perform the test, that is Allen test. So what can we do in the Allen test? Firstly, tightly close the fist by applying pressure to it, and on apply the pressure, the blood circulation should stop, and after that forcefully compress this radial artery and this ulnar artery with the help of any assistant. Both arteries are compressed. After pressing, we release the ulnar artery branch and open the fist, and see that the circulation of the ulnar artery will be normal within 5 to 6 seconds. If the color becomes pinkish, it is normal, and if doesn't return to pink, remains white, it means there is no proper blood supply by the ulnar artery. Then we cannot cannulate this radial artery because there is patency of the ulnar artery is not good. then we cannot cannulate this radial artery. We prefer any other artery like a femoral artery for taking the sample of ABG analysis. So this is the Allen test in which we should check the patency of the ulnar artery for withdrawing sample from the radial artery for assessing arterial blood gas for acid-base imbalance. If patency of the ulnar artery is good, then we should take ABG analysis sample from the radial artery. After taking the sample, apply pressure for at least 5 minutes on that area by which sample should be withdrawn to prevent the bleeding. And for ABG sample, we can use heparin knife syringe to collect the sample to prevent the coagulation of the blood, because heparin is an anticoagulant and it prevents the coagulation of the blood. As we have discussed, ABG sample is collected in heparin knife syringe to prevent the coagulation of a blood, and apply pressure for at least 5 minutes on that area by which sample should be withdrawn to prevent bleeding. So let's take a view on the question: which arterial vessel collateral circulatory adequacy should be determined while taking blood from the radial artery? As we discussed, we have to check ulnar artery collateral circulation when we draw sample from the radial artery. Here the right answer is ulnar artery. And why we cannot prefer carotid artery? We cannot prefer carotid artery because if there is any blockage or obstruction present during needle insertion, it may cause less blood supply to the brain and there is a chances of stroke, and it is a very dangerous condition. So we cannot prefer the carotid artery for drawn sample for ABG analysis. And what about the brachial and femoral artery? These both are the alternating artery for drawing sample from for ABG analysis, but have several disadvantages, like harder to locate because they have less superficial than radial artery and also have poor collateral circulation. So first preference we will given to the radial artery, and with radial artery we should check the patency of the ulnar artery. So here the right answer of this question is option 1, that is ulnar artery, and the rationale behind it is the Allen test is only performed to check the adequacy of the radial artery, and Allen test is not determined to check the adequacy of carotid, brachial and femoral circulation. So here the right answer goes to ulnar artery. Now the next question is: the nurse is caring for a client who is receiving total parenteral nutrition through a central venous catheter. Which action should the nurse plan to implement to decrease the risk of infection in this client? So in this question, the nurse is caring for a client. The client receives total parenteral nutrition by central venous catheter. So what action nurse should include in the plan of care to prevent the risk of infection in this client? So firstly, discuss about the total parenteral nutrition. What is total parenteral nutrition? Total parenteral nutrition is a nutritional support that supplying by glucose, protein, fats, vitamins, various electrolytes and trace elements to maintain the body's development. And it is for patients who cannot have per oral intake of fluid. When to be need TPN? Basically, when the patient has no oral intake of fluid, then we recommend total parenteral nutrition. The patient who is not able to take food orally, then we will recommend total parenteral nutrition to that particular patient. And what are the indications for giving total parenteral nutrition? The patient who is suffering from GI upset from long time, in this patient we should prefer total parenteral nutrition. In case of severe burn and in case of HIV patient, in case of cancer, liver cirrhosis and like pancreatic cancer, these all cases of patient we will prefer total parenteral nutrition, in which patient is not able to take food orally. And what are the forms of giving total parenteral nutrition? There are mainly two forms by which we can give total parenteral nutrition to the patient. First one is central parenteral nutrition, and second one is peripheral parenteral nutrition. If we talk about central parenteral nutrition, in central parenteral nutrition, it should be provided by a central line. In central line, there are two sides. One is internal jugular vein and second one is by subclavial vein. These two veins are preferred to provide central parenteral nutrition by using central line. And second one is peripheral parenteral nutrition. In it, the nutrition is provided by a peripheral route. In it, it is provided by a peripheral inserted central line catheter. In it, two sites are preferred, that is brachial and cephalic. And this total parenteral nutrition is supplied by using central venous catheter. And let's talk about what is central venous catheter. These are the large bore catheters that can serve as a direct entry point for microorganisms into the heart and circulatory system, so as to prevent entry of microorganisms or to prevent infection. Always use sterile techniques during inserting the central venous catheter or during changing the dressing. The site should be cleaned from inner to outer side. So, according to the question, what action should be planned by the nurse to decrease the risk of the infection in the client? Let's see the options. Option 1 is track the client's oral temperature. Tracking the oral temperature of the client is an assessment method. It does not decrease the risk of infection in the patient. So, this option is not applied here. Option 2 is administer antibiotics intravenously. It is an intervention. When patient came in exposure with infection, then we should provide antibiotics intravenously. So it is an intervention. By this, the risk of infection does not decreases. So this option is not applied here. It is an intervention used after the exposure of the infection. And option third is evaluate the differential of the leukocytes. Here there is assessment of the WBCs and it is also assessment method. It is not applied here. To prevent the risk of the infection, we should use sterile techniques for dressing change while changing the dressing of the client with the central venous catheter. So the option 4 is right here, using of sterile techniques for dressing change to prevent the risk of infection. So here the right answer will be option 4, use sterile techniques for dressing changes. The rationale behind it is sterile techniques are very vital during dressing change of central venous catheter, because central venous catheters are large bore catheters that serve as a direct entry point for microorganisms to the heart and circulatory system. So here using aseptic techniques to avoid these catheter related infections, so we can prefer use of sterile techniques for dressing chains during insertion of central venous catheter for providing total parenteral nutrition to the client. Now let's move to the next question. The next question is, the student nurse is listening to a lecture on serum electrolyte levels and the use of isotonic solutions. Which statement by the student nurse indicates that the teaching has been effective? In this question, there is a student nurse who is listening a lecture on serum electrolytes. That in serum electrolytes include like sodium, potassium and chloride, and also the use of isotonic solutions. Which statement of student nurse indicates that the teaching provided is effective for her and she understands the concept well? So before going to the options, let me discuss about what are serum electrolytes and what are the different types of solutions. What are serum electrolytes? Electrolytes are minerals that are present in our blood and body tissues, and the main electrolytes are sodium, potassium and chloride. And the electrolytes are important for maintaining the fluid and the pH in the body and for maintaining the nerve and muscle functioning. And what about the serum electrolyte test? Serum electrolyte test is mainly done as a preventive health checkup, and it is done to evaluate the various kidney and heart diseases, to assess the condition of kidney and heart, and it is also done to monitor the condition of the patients, and about the diuretic therapy, is it effective on patient or not, or about the effectiveness of intravenous fluids, or in case of dialysis. So these are some important points for what serum electrolyte test is mainly performed. And the next one is there are various types of solutions. Then first one is there is a isotonic solution, second one is hypotonic solution, and third one is hypertonic solution. There are three types of solution. Let's talk about the solution one by one. So first solution is isotonic solution. The isotonic solution is that in which has same salt concentration as that of cells and body, cells and blood. And the examples of isotonic solution are normal saline, ringal lactate, and dextrose. In isotonic solution, the tonicity of means the concentration of the salt and water in the fluid, and in isotonic solution the osmolarity of the solution and the osmolarity of the fluid is equal. And the second one is hypotonic solution. In hypotonic solution, these are the solution that contains less dissolved particles, the dissolved particles like salt and electrolytes, than is found in normal cells and blood. In hypotonic solution, there is less dissolved particles as compared to the cells and blood. The main examples of hypotonic solutions are normal saline 0.225%, normal saline 0.335%, normal saline 0.45%, and distilled water. And the third one is hypertonic solution. In a hypertonic solution, there are more dissolved particles like salt and electrolytes than found in the normal blood cells. In their large amount of dissolved particles present than as compared to the blood and normal cells of the body. The main example of the hypertonic solution are dextrose 10%, dextrose 25%, dextrose 50%, and normal saline 3%, and mannitol. These are the examples of hypertonic solution in which concentration of the dissolved particles is more than of the body. So the which statement by the student nurse indicates that the teaching has been effective for her. Now the first option is 10% dextrose in water is hypotonic solution. As we discussed, 10% dextrose in water is a hypertonic solution, not a hypotonic solution. So this option is wrong. And the next option is 3% sodium chloride solution is hypotonic solution. This option is also incorrect. We have previously discussed 3% normal saline is also a hypertonic solution. So this option is not applied here. And next one is 5% dextrose in water is considered as an isotonic solution. This option is right. And the option 4 is 0.45% sodium chloride solution is hypertonic solution. So the 0.45% sodium chloride is a hypotonic solution, not a hypertonic solution. So this option is incorrect. So the option third is correct. 5% dextrose in water is considered an isotonic solution. This treatment by the student nurse indicates that the teaching provided to the student nurse has been effective. So here the right answer is option 3, that is 5% dextrose in water is considered as an isotonic solution. And the rationale behind it is, we have already discussed that 5% dextrose in water is an isotonic solution. That means the osmolarity of the solution is matched with the normal body fluids, and examples are 0.9% sodium chloride and ringal lactate. So here the right answer is isotonic solution includes dextrose 5%. The isotonic solutions are mainly given in case of hypovolemia to raise the blood pressure, and the hypertonic solution are mainly given in case of hypernatremia, that in which the level of the sodium decreased in the body of the client. And for hypotonic solution, these solutions are mainly prescribed for the patients with dehydration. So it's all about the type of the solution. Now the next question is, a nursing student is asked to conduct a clinical conference about autism. Which characteristic should associated with autism should the nurse plan to include? So first of all, we will discuss about the autism and what are their clinical characteristics. So let's talk about autism. Autism is a qualitative impairment in social interaction, communication, restricted repetitive and stereotype pattern of behavior, interest and activities of a person. And autism is a neurodevelopmental disorder of brain. It is mainly seen in child up to 3 years of age. And in autism, the child has their own world and he is not interested in the social activities. And autism is also known as ASD, that is autism spectrum disorder. In autism, people with autism have trouble with communication, and they may have problem with what other people think or feel, and it makes harder for them to express themselves in front of others, and they might have problem with learning. Next, we talk about the various types of autism. The types of autism includes mainly four types. First one is Asperger syndrome, second is pervasive syndrome, third is autistic disorder, and fourth one is Rett syndrome. Let we discuss one by one. If we talk about the Asperger syndrome, in it people with this syndrome are intelligent and do their daily work, but they may have problem in socializing, and they may have symptom like poor social interaction and have a few facial expression, and they have limited interest in activities. And second one is pervasive syndrome. This type of disorder include delay in development, social development and communicational development. And people suffering from this pervasive syndrome might be confused about the world around, and they also have a less power of imagination. And if we talk about the third one, that is autistic disorder. Autistic disorder is also known as Kanner's syndrome. It is a type of severe type of autism. Autistic disorder is a severe type of autism, and symptoms could be like lack of communication and intellectual skills. And these types of people may be sensitive to touch, sound, or light at intense level. And in autistic disorder, they have less eye contact and they not responding to their name and have inability to communication. And last is Rett syndrome. If we talk about the Rett syndrome, basically it is found in girls, and there is a communication impairment seen. It impairs the person's ability to move hands, teeth grinding, mental retardation, and delayed growth. These are mainly the four types of autism. If we go to the sign and symptoms of the autism, then first one is there is a lack of eye contact. Second is hypersensitivity to light, touch or sound. And third one is trouble adapting changes in life, and they have narrow range of interest, and have difficulty in expressing emotions or feelings. These all symptoms are seen in the autistic children. If we talk about the some causes of the autism, and the autism is caused by some genetic causes, there may be some environmental factors, and it is due to some birth complications and due to premature birth. And if we talk about the treatment for the autism, so there is no cure for autism, but if diagnosed in early age, many types of therapy can be given as a treatment strategy for the child with autism. So, according to the question, the characteristics associated with autism. Now, the first option is a normal social play that ceases by age 5. So, in a child with autism, they have abnormal social play, not a normal. So, option 1 is incorrect answer because the autism child have lack of social interaction, and the option 2 is right answer. There is a lack of social interaction and awareness in the child with autism. And the option third is the consistent imitation of others' actions. The child with autism could not able to imitate the others' actions. He is in his own world and not interested in the social activities, and there is a lack of communication seen. And the option this option is also an incorrect one, and the option 4 is non-verbal but abnormal verbal communication. In it, abnormal verbal communication as thereof abnormal non-verbal communication both are present. The verbal communication is not normal, both are abnormal. So here the right answer will be option 2. In a child with autism, there is a lack of social interaction and awareness may be seen. So the right option is option 2, that is lack of social interaction and awareness. And rationale behind it is, as we discussed, that autism is one of the severe developmental disorder mainly seen in the infancy and in a toddlerhood, that is a age of 1 to 3 years. And the characteristics are like abnormal social interaction, lack of communication, and lack of eye contact. All these are the symptoms seen in the autism children. Now, the next question is, which interventions are appropriate to include in the plan of care for a child after a tonsillectomy? Select all that apply. In this question, there is a child who has performed tonsillectomy. Tonsillectomy is performed for a child, and after tonsillectomy, what interventions are included in the child care plan? Now, before going to the options for correct answer, let me discuss about what is tonsillectomy and why it should be performed. Let's talk about the tonsillectomy. Tonsillectomy is the removal of the tonsils. And what are tonsils? Tonsils are the oval shaped pads of tissues present at the back of the throat. If there are any inflammation of the tonsils, it is termed to be as a tonsillitis. And what are the functions of these tonsils? Tonsils can stop the entry of germs in the body through nose and oral cavity, and they also kill the germs. And the tonsillectomy, that is removal of the tonsils, and tonsillectomy can be performed under general anesthesia, and this surgery could take 20 to 30 minutes to perform this surgery. And after that, the question is, why is tonsillectomy to be performed? So if there is any throat infection that keep coming back 6 or more times in a year with infected and swallowing tonsils, then there is a need to remove the tonsils by doing the surgery, that is tonsillectomy. And the another one reason is tonsils are causing difficulty in breathing during sleep in some children's, and this is often seen as frequent snoring. In this case, we also perform the removal of the tonsils, that is tonsillectomy. And if we talk about what can be done, what can occurs after the tonsillectomy, so after the tonsillectomy, pain is common, And for relieving the pain, we should prescribe pain medication to the client. And there may be a discoloration seen where the tonsils were removed, and when the area is healed completely in about 3 to 4 weeks, then the discoloration will be gone. And there is a risk of bleeding after the tonsillectomy, and this will be decreases after 10 days. And next one is, what are the food items that should be eat after the tonsillectomy? The recommended food items after tonsillectomy are water or any liquids that cannot hurt the client, and ice cream, pudding, applesauce, mashed potatoes, and there is a need to avoid hard and spicy foods for some days. And these are the mainly foods that are recommended after the surgery, that is tonsillectomy. Now we will talk about what position will be given after the tonsillectomy. Mainly side lying position is given after the tonsillectomy. Reason behind it is to drain the secretions and to prevent the aspiration. Now let's see the question. What intervention should be provided after the child with the tonsillectomy? So the first option is offer clear cool liquids when awake. The child with the tonsillectomy, we have to provide some clear and cool liquids for a few days after surgery, and this option is applied here. It is a correct one. We will provide clear and cool liquids to the child. And option 2 is administer pain medication as prescribed. Yes, there is a pain after the surgery, so we will provide the pain medication to the child. And the third one is monitor for bleeding from the surgical site. It is also an important intervention that we will be monitored after the tonsillectomy. Providing the pain medication and monitor for the bleeding from the surgical site, these both are the common interventions that should be performed after any of the surgery. And there is an option suction every 15 minutes and PRN as necessary. There is a need to prepare a suction apparatus at the nursing station, but there is no need to apply suction. Suction is applied only when there is any airway obstruction seen, then we should perform the suctioning to the client. And in this case, there is no need to perform the suctioning to the child. So this is not applied here. Suctioning is not very much important intervention in that case. And the next option is initially eliminate milk or milk products from the diet. Yes, we should eliminate milk and milk products from the diet because milk and milk products may increase the mucus secretion. So here the right option will be option 1, 2, 3 and 5, where we will offer clear cool liquids to the child and also administer pain medication as prescribed by the doctor and monitor for the bleeding from the surgical site and avoid milk and milk products from the diet. Suction is also important but not much important because we should only perform suction when there is any airway obstruction seen. So it's all about the today's video. Stay tuned for the next episodes of question. If you want previous videos, you can go to the channel playlist for more videos. And thanks for watching the video.